So hello everyone, here we are at Richardson Hospital. This is post-operative day 8 for this patient post rhinoplasty. Here you see me removing the splint gently. Alirka. So this splint stays intact for a period of 8 days till the patient is discharged from here, and off it is. So I'm just going to hand over the mirror to the patient and I will show you how he looked before the surgery. Let me just clean up a little bit. He looks happy. Are you happy?
Super happy.
He says it's superb. So this patient had a very prominent dorsal hump. Maybe clean this later after I show you. So you see what a nose in the frontal view, he had quite a short nose. Now we have enhanced the length of his nose. Also a depressed radix, if you can see. This is the golden view right there for you. Can you look towards your side? So there are many things that you can appreciate in this view. One, the radix, it was quite depressed. As you see, there is almost a U shaped at the radix that we have totally augmented along with the dorsal height. So dorsal augmentation has been done. The dorsal hump that you see here, very prominent, that has completely gone away. It's vanished and now he has a very straight nose. The length of the nose is very short, and even if you can see the nostrils from the sides, which is not seen right now. So overall, a lot of things have been improved. Are you happy? First you tell me, are you happy?
I'm so happy.
You're so happy?
But why? Numbness.
Numbness? Okay. So he's complaining of a numbness towards the tip. This can happen because the splint is placed over the dorsal region. We have a lot of dynaplasm, lot of steri-strips placed. The only exposed area will be the tip. So because of the pressure, he might feel that way, but it should go off on its own within a week or maybe less than that. It should be fine. Now I am going to proceed with the suture removal. I'm going to clean all this up. These tape marks also, I'm going to take all of them off. Alar base, there are sutures present bilaterally even on the columella. So all of that I'm going to remove. How was your stay at the hospital? You have to tell us.
Very nice.
Very good. Were you comfortable?
I'm comfortable with the stay and comfortable with communicating with
Doctors.
doctors.
And how was your pain? Did you have lot of pain?
No pain. For first few days, the face has
Swelling?
lot of swelling and then no pain.
All right. So that's a good thing for all those people who are scared of rhinoplasty because it will hurt or they will have post-op pain. The patient says he had swelling, which is because of the osteotomy. Done bilaterally, patients tend to have periorbital edema post-op, especially on POD2, POD3, but it settles on its own. Now if you see, actually he has very minimal edema. Here at the tip he does have some swelling, also in the alar base region. Again, that should also come down, but overall his results are remarkable. I would say near excellent, and after the swelling comes down a little more, we will ask the patient to send his post-operative pictures so that we can appreciate the final results, and that should be in 2 months or 3 months. Thank you.